It's hard enough to be a chiropractor in 2024, let alone the fact that recently there was a regulation 16A-66 called the consideration of criminal convictions that was going to increase the number of things that you, as a chiropractor, can get in trouble for. Hi, this is Dr. Keith Miller, president of the Pennsylvania Chiropractic Association, with a win of the PCA and for all 4,000 chiropractors in the Commonwealth. As mentioned, this recent regulation draft would increase the number of criminal offenses that chiropractors could lose their license, get suspended, get fined, get sanctioned, to 39 different offenses. Yes, you heard that right, 39 different offenses. Well, when we saw the draft back in November of 2023, the PCA read it over and we looked at what was there for chiropractors and what the proposed regulations were for MDs, DOs, nurses, PTs, OTs, and XYZs. And what we found was chiropractors were being unfairly targeted, and we're going to have way more things that we can get in trouble for that were mandatory that we would get penalized by the chiropractic board. We thought that this was not only excessive, since many of these things had nothing to do with the practice of chiropractic, but we believed this was unfair and discriminatory because so many of these items that we were going to have, these 39 items, were not going to happen to any other healthcare provider. So if you look at the attached PDFs below, the one that is the final delivery package is the one you want to look and open at. On page 3, you'll see where we submitted testimony that we said that we thought this was unfair, where we compared this to the other boards, where we said that this was discriminatory and that we believed that there should be a parity between all healthcare licensees, that no one licensee of any of the professions should be held to any standard higher or lower than any other one. If you look on page 4, they specifically even mentioned the PCA testimony and this parity that we believed was so vital to make it fair and equitable for chiropractors. If you then scroll all the way down to page 118 and 119, you can see where we again are mentioned in this testimony and in the rebuttal arguments, only to find out that, congratulations, the PCA was successful in convincing the state and the state regulators that everything we said was true, that chiropractors were indeed being singled out for very different things. So instead of 39 different offenses, the PCA was successful in getting 29 of those kicked out, and there will only be 10 offenses that are kept in there, and we will now have parity to the other healthcare professions. Congratulations to all of us. We now have less things to worry about, but we can get back to the business of chiropractic. If you look on page 144, 145, and 146 of the attached document, you'll see the ones that got removed, and you'll see the ones that now remain. So it is one thing that the PCA has done recently for you, whether you're a member or a non-member, to make practicing in Pennsylvania that much better and easier and safer for chiropractors to be able to exist and see our patients without fear. Yay, PCA. This is where your dues go. If you're not a dues paying member, please become a dues paying member. Additionally, on top of this, there's so many other things that the PCA is doing for you. House Bill 630 to restore delegation that was stripped by a rogue judge in the State Farm versus Cavoto case. The Scope Modernization Act, which is in the draft form right now, and we are searching for a sponsor. This will update our scope of practice. Chiropractors were first registered in the Commonwealth in 1951. There was a license update in 1986. And except for the student intern law that the PCA passed a few years back, essentially we're practicing on a 50 to 75-year-old scope of practice, which is why it's so important, because New Jersey got extremities taken away. In Texas, the Texas Medical Board almost was successful in having chiropractors require referrals, just like PTs and OTs did. So without updating our scope of practice, we're one step away from basically losing all of our rights and privileges. That's why this is so important. The PCA is also in the process right now of creating a bill that will reduce copays and peg your reimbursement to Medicare. And lastly, we're looking into getting PIP increased because so many chiropractors have been complaining that by the time the patient gets out of the ambulance and leaves the ER, that entire $5,000 PIP is wiped out and there's zero money for the patient to actually get real care, instead of just a transport, a CT, and they said there's nothing you could do and go home. So the PCA is working hard to help all 4,000 chiropractors in the state. We ask you to go to the link below to penchiro.org and become a member if you're not already. Please make a voluntary contribution on top of your membership to the Political Action Committee to help us get those 4 bills passed so we can make this a better state for all of you to practice. Once again, Dr. Keith Miller, President of the Association, and we are all at the PCA working hard to help you be successful in practice. Bye now.